With us now is Dr. Gary Levine, and he is an OBGYN. Really happy to have him here. I used to work for an OBGYN, in fact, but things have changed. Technology has changed. Delivering babies hasn't, as long as you have a wonderful doctor. Welcome to the show. How are you?
I'm very well. Thank you for having us.
Good. Now, I learned something about you, and that is the fact that you take a woman from the time that she is starting to mature, let's say, all the way up to aging beyond, and you kind of walk them through that. You're their partner, I guess, in their healthcare.
That's correct. I have 6 partners and 1 nurse practitioner. We do totally private OBGYN. We have 3 offices, and we do everything out of Winthrop University Hospital. We start seeing the patient at usually bring the patient in around the age of 16, although that's not a hard and fast rule. You have to individualize when to bring, quote unquote, your daughter into the obstetrician. You have to see what her social situation is, what kind of questions she's asking you, so you may bring them in earlier. It doesn't mean that they necessarily even have to be examined, but it's important to have some rapport with the obstetrician gynecologist at that point on a forward basis. And then we would take them through, once the age progresses, through the obstetrical care, through the gynecological care, through menopause, all the way through on an individualized basis.
I just turned 50 this year, so that M word is of concern to me. And interestingly enough, I had lost my mom to breast cancer. She was 45. And as a woman ages, you have different questions at different times in your life. What do you love most about working with women?
I think working in obstetrics and gynecology, you get to work basically with a young, healthy woman, which is different than a lot of fields of medicine. And most of the time when the patient comes in, it's to hear a positive result, most of the time. Medicine is based on negatives. You go to a doctor, oh, I'm glad I don't have a heart attack. I don't have colon cancer. In obstetrics, usually the patient wants, yes, you are pregnant. Excellent, positive. Great feel for the patient most of the time. Terrific feeling for the physician, and that bounces back and forth between the individual and maintains itself through the entire pregnancy. And therefore, that type of positive feel goes all the way through the rest of the woman's health and wellness and us taking care of the patient.
And technology has changed, between ultrasounds, and you keep up on all that equipment. You have the latest state-of-the-art stuff.
We have ultrasound in the office, all sorts of testing for bone density, for osteoporosis in the older woman. But I think perhaps the most dramatic advance that I've seen, one of them, has been the advent of ultrasound for the obstetrical patient. You have to realize that years ago, the obstetrician was taking care of 2 patients at the same time, and you could only examine one of them. That's unique in medicine completely. Now, with the advent of ultrasound, we can see the second patient, examine the second patient, diagnose various situations, look at blood flow to the placenta, blood flow to the fetus. So that's really taken off tremendously. And technology-wise, the other item that I'd like to mention would probably be the advent of robotic surgery. Because now we're doing surgery that we used to have to do through large incisions. The incisions now are 1 inch to 1.5 inches. We're doing major surgery, instance hysterectomy, removing a uterus when necessary. Patient can come in the morning, do the procedure, go home that evening, drive the car in 48 hours, and go back to work in 10 days.
At what age did you know that this was going to be your gift and your destiny? Like, what was the moment of inspiration for you that you said, this is the field of study, this is what I'm going to practice?
Well, when I was in medical school in Chicago, I was rotating through obstetrics and gynecology in Cook County Hospital, where they were doing 10,000 deliveries a year. And it was just an amazing experience to help a woman deliver a baby. because it was such an positive, most of the time, situation that I said, I have to do this.
The joy
I have
of
to
it.
be in a positive field.
Absolutely, and you've invested a lot in your practice.
Yes.
So what you do is you want to be there. You want to be the person that has the best equipment,
Yes, that's
offering the
correct.
best care, because it helps you be a better physician.
That is absolutely correct.
And I would think also with the technology, like you were talking about robotics, there's more positive outcomes for birth because now people can do surgery in utero, right? And so more babies are living.
Yes, that is also correct. But that's a whole different field. That's the
Yes,
field of
that's when you
fetal
have to pass it off to your friend. I
That is
know,
the
right.
field of fetal surgery, which is beyond our capability.
But once you know something and once something is diagnosed, I know that you have people there that are
Yes.
friends of yours that you work together as a team.
Yes, that is correct.
Wonderful stuff. Any memorable, I mean, after delivering so many babies, any memorable births for
Well,
you?
there would be two situations that were memorable. The first one would taken place probably about 25 or 26 years ago was my first incident of delivering triplets.
Wow.
It was a patient who was difficulty getting pregnant. We had to put the patient on fertility drugs, and the patient made it till about 4 weeks before her due date. She went into labor. We delivered 2 girls and a boy. All right. And recently what happened was I had another patient who came in and said, you know, Dr. Levine, one of those triplets that you delivered works across the street, and she's an ultrasonographer.
Wow.
So that was
Did you
very,
do
very
lunch yet?
exciting. No, we didn't do lunch
I think you
yet. We
should
didn't
do lunch.
But the other item that's, I think, very memorable for me and is continuing is now I'm delivering patients that I've delivered.
Ah,
So here we are in the labor room. The patient is in labor. I've delivered the patient. The future grandmother is in the labor room, and now we're delivering the grandchild. And you can't, I mean, talk
Tears.
about cohesion and follow-up care and being on a constant high. That's what it's about.
well, your reputation precedes you. I've heard many good things about you throughout the community over the last 20 years. And when I found out that you accepted our invitation to be on the show, I wanted to thank you personally. You know, and I know that there's probably babies that you're going to go and deliver today or tonight, right?
Yes, that's probably, you never know.
You never know. Winthrop is calling. Is
Yes,
Dr. Levine in there?
absolutely.
So thank you so much
You're
for
very
joining
welcome.
us. And
My
thank you for
pleasure.
helping women be healthier. It really,
Thank you.
it really matters. So
Yes,
thanks
I
for
think
being
it
a
does.
champion for us. Really. Thank you.
Thank you very
so
much.
very much. Okay, stay tuned for more. If you're a woman or if you're a man that loves a woman, call Dr. Levine and he might have the answers for you. Thanks for watching.